Hello everyone and welcome to this video around the primary survey. My name's Mark and I'm from Event First Aid UK. So we're going to jump straight in. What is the primary survey? Basically, it is a procedure for us to follow on the scene of any incident. This ensures that we treat the most important thing first to try and help and save as many lives as possible. This follows the same priorities as used by the emergency services. It's made up of 5 letters: D, R, A, B, C, sometimes referred to as Dr. ABC. So, the first part, the D of the primary survey, is danger. So, we need to make sure that we keep ourselves safe as we are the most important person on the scene of any incident. We can do this by completing a scene assessment. So, how do we check if a scene is safe to enter? Well, we're going to be using all of our senses. So first of all, our sight. So we can look around to see if anything is on the floor or above, what we call a 360-degree overview. So look all the way round you to make sure it is safe to enter. Smell. We can see if we can smell gas or fuel, as that may be present in the room, and that might mean it's too dangerous for us to go in and help the patient. Feel. We feel to see if there's any heat or cold. And hearing, you might be able to hear electrical arcing, gas leaking, or even a fire crackling. If it is unsafe for us to enter the scene, then we don't. Just by calling 999, you are still helping that patient, and we're not creating another patient by us rushing in there and possibly getting injured. The next part of our primary survey is R for response. In the response element, we're looking to see how they respond to us. So there's different levels of response that we have. So first of all, you have an alert patient. Someone that is alert will be sitting up, talking, doing stuff without actually being asked to do anything. V stands for voice. So they respond to our voice. So we'll give them a command like, hello, my name's Mark. Open your eyes. Wiggle your fingers if you can hear me. You then get P for pain, or sometimes referred to as pressure. So you're looking to see if you get any response to this. And we do this by gently squeezing the shoulders and seeing if we get any sort of facial movements, a grimace, a sort of shying away from the pain. And then finally, you have U, which is unresponsive. This is where the person hasn't responded at all, and we need to help these people as quickly as possible. The next bit we then check is A for airway. So we need to do an airway assessment. So first things first, we need to check in the mouth and make sure it is clear. If there's anything in there, you can clear the mouth out by turning the patient on their side, known as postural drainage, and clearing anything from the airway. Once you believe it's all clear, rotate them back onto their back, check it's clear, and then we're going to open the airway by doing a maneuver known as the head tilt chin lift. So you place one hand on the forehead, 2 fingers under the chin, and tilt the head back. Once we've got that head back into that position, we're going to check for breathing. We're going to check for breathing for a minimum of 10 seconds. You're going to use what we call the look, listen and feel technique. So with the head tilt chin lift still into position, you're going to place your head over their mouth. You're going to look down the body. You're going to listen for any breathing. You're going to see if you can feel any breathing on the side of your face, and you're going to look for chest rise and fall. If you get less than 2 breaths in 10 seconds, then you need to start CPR immediately. This is all covered in another video on our YouTube channel and Instagram. If the person is breathing more than 2 in 10 seconds, then you need to place them into the recovery position and closely monitor them for any deterioration, keeping an eye on their breathing. You then need to think about C, which is either CPR or circulation. We cover CPR in another one of our videos, but as a quick recap in this video, you have chest compressions, reopening the airway and giving rescue breaths. So you do 30 chest compressions followed by 2 rescue breaths using 2 hands. This is for adults over 18 years of age. These compressions need to be delivered 100 to 120 in a minute, 1/3 of the chest depth. With a child, it's still 30 to 2, but this time you're starting off with 5 rescue breaths. One hand if you can get adequate chest depth. You're then 30 to 2, and this is for our 1 to 18 years of age patients. This is also the point where we would consider any bleeding treatment and or circulation problems like heart attacks, for example. They would all be considered here, and we will deal with our minor bleeds and wounds within this segment. So, as a quick recap of the primary survey in its entirety, you have D for dangers, that 360 awareness, using our senses and making sure we do a thorough scene assessment. You have R for your response, using AVPU for alert, voice, pressure or pain, and unresponsive. You then have A, airway, is it clear, clearing it as required, and then making sure it's open to make sure the tongue hasn't dropped to the back of the throat and blocked it. You then have B for breathing. We're looking at how they're breathing. Is it more than 2 in 10 seconds? Less than 2, we're moving on and going to our CPR. And if they are breathing more than 2 in 10 seconds, we are looking at our recovery position. And like we just alluded to, with our C, it's looking at our circulation, our minor bleeds, or our CPR. Just remember, this should be followed in any medical scenario. It doesn't matter what the situation is. This training is given to all different levels, from first aiders up to paramedics. We all follow the primary survey. So now we're going to chuck in another consideration called catastrophic bleeding. Catastrophic bleeds is described as a bleed where you will lose your entire body's blood volume within minutes if it's left untreated. Due to this, it can be prioritised before the airway in the primary survey. This gives us a new primary survey of Dr. C. ABC. It's fixed very simply by wound packing or tourniquet. So these are quick applications so we can move on. And once we've controlled that bleed, we return back to our primary survey with the airway check. This is a prompt, quick intervention so we can continue the primary survey, because there could be other life-threatening conditions that we need to deal with. But we need to deal with this first of all, as if you were to start CPR and there's a catastrophic bleed, as you're doing your chest compressions, you could pump further blood out the body, leading to patient deterioration. We're now going to look at what questions the ambulance service is going to ask. They're first going to ask, is the patient breathing? This is because if they're not breathing, they can give you CPR advice a lot quicker. This goes the same as when they ask, is the patient awake? If they turn around and say they're not, they can give you the recovery position advice. They're then going to say, okay, tell me exactly what's happened. At this point, give them as much detail as possible to the incident that they're possibly coming out to. This allows them to best triage the call to get the best response for the patient. They're then going to ask, what is the address of the emergency? You need to give them a full address, including the postcode where possible. If you're in a location you might not know, something like what 3 words is really useful, and all emergency services now use that. They're then going to ask, what's the phone number you're calling from? Sometimes it will come through to the call handlers, but they will always still ask you for it. The reason these two are in red, even once you've given that information once, they will ask you to repeat it just to ensure we have it 100% correct. They were then asked, what is the patient's age? If you're not 100% sure, give an estimate of what you believe they are. They then asked, are they male or female? They will then reconfirm, is the patient breathing and is the patient awake? Then the call handler will ask you a relevant set of questions depending what you've said in the tell me exactly what happened area. and it'll be around the patient's care to give them the best possible care and treatment until the ambulance arrives, while also working out what is the best resource to send. The next one we're going to look at very quickly is medical alert information. Sometimes you might have an unconscious patient that you don't know, and medical alert information can give you an understanding of what is happening with this patient. So they come in many different forms. The most common type is this, like the metal chain that goes either around the wrist, the neck, ankle, for example. They quite often have a phone number so you can contact them with the membership number to find out further information. This is normally done by the ambulance crews. But on there will be quite pertinent medical information, such as you can see here, a type 2 diabetic that's got an allergy to penicillin. They come in different forms. You can have like rubber band types that might only be used in sort of special events, for example. And they come in again different forms. So you can have like paracord bracelets, chains, necklaces, for example. And some people even get them tattooed on themselves. Something that a lot of people don't realize is your phone actually has this information on as well. And you can set this up on any phone, whether it be Android or Apple. And it is called in case of emergency information. And you can unlock this on the lock screen, and anyone can do this at any time. So it is worth checking if you set this up on your phone with your information, because it is somewhere that the emergency services will go and look. I hope you found this video informative. If you would like to learn more, then please do get in touch with us today. We offer many different training opportunities as well as event medical cover. So please do get in touch, or do follow our YouTube video or Instagram page, as we do post new videos all the time. Thank you again for listening, and we do hope you enjoyed this video.